It's the Kerri Kasem podcast with Ashley Marriott, and we're doing a very special edition of the podcast today. Yes. We're inviting back people that haven't been on the show for a while, but we've seen them almost every week. I have.
You have.
I have. How are you doing, Ash?
I'm good. As you know, I was researching how to get a more cost-effective boob job.
Yes.
And I did find something that really has worked.
I see it, and I can't believe, and it's all natural.
It's called pregnancy.
Yeah.
And it's totally free, and your boobs get bigger.
It's fantastic. No, but
it's great.
For everybody that doesn't know, we haven't been on the air for a while. Ashley is pregnant, so congratulations.
Thank you.
Yes, that's awesome.
I know you're very excited.
So excited. I'm actually excited. Come on. Years ago, I probably would have been bummed because we wouldn't be able to hang out as much.
Yeah,
but
good.
I'm excited for you. But let's say hi to our guests.
Yes.
Welcome back to the show, Dr. John Shieh and his gorgeous wife, Floy. And you may remember Dr. John Shieh. We've done specials with him. He's a specialist in anti-aging and skin rejuvenation, also body sculpting, and you've been doing it for the past 11 years. Now, a lot of people may recognize you because you've been on Entertainment Tonight, Keeping Up with the Kardashians. That's how I found you. Extra. You've also been in a ton of publications. And Floy, you manage and you're a consultant at RejuvaYou Medical Spa, which you two own.
Yes, thank you for having us. We're excited to be back.
Thank you so much, Kerri, for having us.
Oh, come on, always. And I see you two pretty much every week because I am doing this incredible laser that is brand new, and it's called the Spectra Laser. I'm saying that right, correct?
Yes.
And for those of you who know and who've been listening to this show, I have been going to you guys for like almost 2 years now, and my skin has never looked better. I mean, I'm talking about when I was in my teens and my 20s, I have better skin now, almost 20 years later.
I can verify that.
Yeah.
Because we were young. We were still in our teens when we met. Way back then.
We were.
Kerri, you had great skin, but you always dealt with a few issues like discoloration,
yes,
even from a really young age, and it's completely gone.
I have better skin now. I'm telling you, I get more compliments now on my skin than ever before. And this is the oldest I've ever been. I'm only getting older.
Well, that's a good thing.
No, you look amazing.
Thank you.
No alternative to aging.
No, there isn't. There is an alternative to aging. It's called RejuvaYou. I'm telling you. My skin looks phenomenal. Now, I did have a problem with brown spots constantly coming back. Constantly. And I was doing the IPLs, the Matrix, all the other lasers that you offered. My skin would look phenomenal. And then there it goes, these brown spots. And I thought they were scars because it just kept coming back, and it was right under my eyes. I had a little bit on my nose, and I was so bummed. So I remember, Floy, you said, you could have melasma. Like, what's that? You said, well, it's created by your hormones. And a lot of people, when they're pregnant, they get this pregnancy mask. Have you ever seen that? It's when it's kind of like you get a dark mustache, you get it on your cheeks, you get it on your forehead. And I said, yeah, I've seen that. And you said that's probably what it is. So I talked to Dr. Shieh. He's like, yeah, well, we have a new laser coming and it's called the Spectra. It's for melasma. Now I've been on this thing now for about 8 weeks, and I am mystified. I am in awe. I am happier than I've ever been with my skin. My brown spots are gone, and you can see this. And we're going to show, I'm going to definitely show you some before and after shots. But can you tell me how this works?
Yeah, well, this is really a breakthrough for us. It's been just a miracle that we've been looking for the past 10 years. And finally, the FDA approves this new laser last year, and it's FDA approved for melasma. Really, it's a huge breakthrough in our industry. I'm surprised it didn't get more press because of how dramatic this treatment can affect people. Women have this, and I think a lot of times women maybe hide from it, or it's embarrassing. So you hide behind makeup and thick foundation, and you don't want to talk about it, and it affects people deeply. Their self-esteem is affected by it. So this device, this laser, works because it's a very advanced technology. Unlike old lasers that would burn your skin or burn the cells and damage them, that would just irritate and inflame the melasma and make it come back. So you'd hear about people that had melasma or they didn't know they had melasma. They went and got a laser treatment and they came back with dark spots on their face. So this new device, because the pulses are so quick and short, it doesn't overheat the skin, but it works inside the cell to reduce those pigments. But the other thing is that in melasma, there are abnormal cells that produce the pigment. Instead of just suppressing the pigment of the melasma, the color, it actually changes those cells into a normal shape and normalizes those abnormalities. That's what we like to do at RejuvaYou. We want to do things that are more than just cosmetic, but we want it to actually change what's inside. We want to make what's inside actually better. And the Spectra Laser actually does that.
So now what if it's not melasma, but you have brown spots and it's not necessarily hormonal? Would this work as well?
Yeah, so the Spectra device, there was a treatment it was just called laser toning, or the Spectra Peel laser toning, and it was a great type of treatment for people who didn't want any type of downtime. You could have a treatment and you go back to work or go to your dinner meeting or lunch meeting or go out that night. Nobody would know you're having a laser treatment done. But when you had these treatments done, the skin would just start to take on a healthier glow, and your complexion would improve, and you just maintain the skin. Nobody knew you were doing anything. What they found was, over time, the people who also had melasma, their melasma was starting to fade. And that's where they started doing more studies, and the FDA finally gave it that approval. But it can be used for people who have some problems in their skin, pigment issues, and they want to still improve it, but they don't want any downtime, or they can't afford to take off time to do this. So in our busy schedule, it's ideal.
Can you tell us, Dr. Shieh, how we know for sure if it's melasma or just like a brown freckle or spot from the sun? What's the characteristic that's different?
Yeah, to know for sure, usually you'd have a skin professional look at it, have your doctor look at it, but there are telltale signs. Typically, if it's a sun-damaged sunspot, we call it a solar lentiginous, but lay people, we might just say it's an age spot, liver spot, freckle, sunspot. So normally sun-damaged type spots would be more random, just freckles, spots randomly around the face. In melasma, you'll notice a certain characteristic when you see a lot of melasma cases. It tends to be sometimes just on the upper lip, like a mustache, and it tends to be symmetrical. So you have an upper lip, maybe it's below the lower lip around the chin area, then you'll have it on the forehead. But if you have it on the right side, you'll also have it on your left side. Sometimes it's not on the central area, it's more on the cheeks, and you see it on both cheeks. And that's what Kerri was mentioning. She had some areas right below her cheeks. So it tends to be something that's on both sides, somewhat symmetrical. And instead of just discrete little random spots, they tend to be a darker patch or a shadow. Sometimes it's not that dark. It could be a deeper shadow that you just wonder why it looks a little bit darker, but it's on both sides. And typically you'll relate it to something like you started birth control and you saw this, or you're pregnant and it showed up. But it doesn't have to be with birth control or pregnancy. It could be just stress, hormone imbalances, and men can also have a similar type of conditions. And usually a lot of sun exposure causes this. So you can tell if you have it, if it's symmetrical and kind of a deeper pigment.
Now, I know Ashley had the IPL RF, another laser that's great for brown spots. It takes
rid
away
of my freckles.
Yeah, it got rid of everything. All your sun damage is gone. Now, she did it one time. And whenever I tell people, is this downtime? I'm like, what am I going to have to do? Am I going to have to do, a series of it? And yeah, it's great to do a series. Ashley did hers one time. And
I want to go back for more.
Yeah.
But now I want the Spectra.
Yeah, the Spectra is amazing. But you're pregnant right now.
Yeah.
Can pregnant women, while you're pregnant, get this laser treatment?
No, you're not supposed to.
Damn it.
Yeah, during pregnancy, we usually just... you just lay off of any elective type procedures, just for safety. But really, these laser treatments are just very superficial. Well, at least just in the skin. Technically, should it affect the new baby? I don't want to say that it's not going to, but really, there's other things that we do in our life and our diet and things that we do that could affect it more. But we want to give our baby the best chance, so we hold off on that, and we have plenty of time.
It's a good push present.
Oh yeah, push present. You have plenty of time afterwards to make it great.
And besides all the lasers that you offer at RejuvaYou, you offer so many different things, like from skin tightening to cellulite reduction to liposuction. There's a whole range of things you offer at RejuvaYou, which I'm very, very happy about because I've tried out most of them and they're awesome. So the show is really, we're talking about melasma, we're talking about the Spectra Laser, but I want people to know that you offer so many things at RejuvaYou. that are just so phenomenal. So if you don't have melasma, there's other things that you guys, offer.
Yeah, definitely. The melasma does fall in that first category of a skin aging that we try to help people with. And we usually, actually, at RejuvaYou, for the skin or the face, we have a 5-step approach. Part 1 would be discolorations of your skin, which could be melasma or it could be the sun damage spots. So Ashley, you had a treatment that was our photofacial RF, the IPL RF treatment that helped to clear the blemishes, the brown spots, and it helps shrink the pores and helps the fine lines, helps the collagen. We know the skin actually becomes a healthier, younger skin with that treatment. And normally we do 3 treatments. With 1, people definitely already see changes. If we could do the other 2, it would be great. If you have melasma, which is also a pigment issue, then we use the Spectra. Part 2 would be laxity of the skin. As we age, our skin gets a little looser. So maybe in our 40s, it starts to droop a little bit, and we can restore elasticity and shrink the skin, help it to contract, and help you avoid having to cut and pull, because that's not really a great option. That's kind of like allowing your skin to degrade to the point that you're having to resort to this last-ditch effort. It's like not taking care of your health until the point you had to have a heart coronary bypass surgery when you could have started early,
right,
and just stayed healthy and exercise, eat well. So part 2 is help firm your skin. Part 3 is help you with texture or wrinkle issues. We have special lasers for that. The 4th thing we see with aging of your skin is volume loss. Volume loss means your face shape changes, and maybe below your eyes it gets kind of sunken in and looks like you have eye bags or hollowed out cheeks. The cheeks sink in. The nasolabial folds, the line below the nose going towards the corner of your mouth, starts to become kind of sharp, and that looks steep. And those are just volume changes, and we can fill those. That's
so
where
those are the injectables.
Yeah, then you can use an injectable filler, which could be something like Juvederm, and that lasts for about a year. And it's a component of our collagen that we're injecting. Or somebody who needs a lot of filling, let's say they need it on their temples, their eyebrow, below their eyes, the nasolabial folds, then we'll use your own fat. And that's actually becomes more economical, and it's actually your own living fat, which feels natural because it is natural. It's your own living fat cells, and that's what you lost, and that's what we'll put back. So that's the 4th thing. The 5th thing is to help protect what we've done now by utilizing things that can help, and one of them is Botox. So if you look at that approach, Botox and fillers aren't the whole picture, which
right.
often is overdone in a medical spa setting because it's easy to just inject it into you. But what we want to do is make sure you're doing everything in balance. Everything should be done in context of everything else, meaning if it's laxity of skin, don't overfill your face to make up for your loose skin, because then you look like a pillow face and it's blown up.
I've seen it.
There's a characteristic look on Housewives of whatever
Blank,
city you
blank.
want. Yeah. Or they over plump things so it doesn't work. If you have laxity, you can firm the skin. Don't cut and pull it, just firm it up and then fill just enough that you need. If you have wrinkles, there are lasers to help smooth the skin and help reverse the wrinkle. Then you just use the Botox to help prevent it and in strategic areas, but don't over Botox your face and paralyze it, because there's no youthfulness in a paralyzed face. I have 2 young kids now, and their faces are very dynamic. That's youth. Who's frozen? Well, probably some people that we've seen on TV that are older and desperate and didn't know what else to do, so their faces are completely paralyzed. They're kind of defining the new look of an old person, which is a paralyzed face. We don't want to paralyze your face. Just use Botox strategically where you need it and in balance. And if you approach it this way, everything's very natural.
Like I've been using Botox for many, many years, and I've said to you when you do my Botox, I need to move my face, and I always say, no, just make sure I can still move my face. And every time I walk out of there, I look natural. I can move my eyebrows. I can move my face. I can make facial expressions. And that is how Botox is supposed to be done. It's not supposed to be where you can't, your eyebrows are just stuck in this surprised kind of look. Or,
right.
I've seen people who Botox their lips where they can't smile.